Folks, welcome back to TopDoc News. This is a special segment on hair restoration. I've never had a problem with hair restoration, but my hair did turn gray when I was 40, almost overnight. It was really quite miraculous. And I have with me Dr. Katona. He is one of the top hair restoration experts, not only in this country, but in the UK as well. Welcome to the show.
Thank you, Bill. It's really great to be on your show. Thanks for inviting me. It's really exciting to be here. We have a lot of information for your audience, for the general public out there about things they can do to maintain their hair, and some also clearly some medical and surgical options that might be right for them. So I think hair restoration surgery is in a tremendous place right now. A lot of misconceptions, and maybe we can clear some of those up and create a roadmap for some of your audience members.
Fantastic. It's all about, self-esteem. It's all about feeling good about yourself, because if you feel good about yourself and you believe in yourself, you feel young, you feel fit and youthful, you're going to go out there and be more successful in life and more prosperous. Is that what you find with your successful customers?
Yeah, absolutely. Whether it's the businessman, the guy off the streets, or even NBA MVP or the number one golfer in the world, or Stanley Cup champions, they all feel the same way about their hair. And I think the consequences of them doing something about it is also the same across the spectrum. They get their hair done, they feel better, they perform better. Of course, sports, that's in the public eye, and you can actually see and measure and gauge that impact. Whereas, for some other individuals, it might be a little bit more subtle. But, certainly for those high level athletes, they get their hair done, their game improves, their self-esteem improves, they get those endorsements, that's stuff that's really right in our face. And one way we can really measure what we're doing for the world, what we're doing for that individual. So it's a very exciting time to be in this field. There have been a lot of changes in the last few years, and we're clearly adapting and changing what we do on an ongoing, very consistent basis that, I'd like to share with your audience.
Fantastic. Now, is most hair loss genetic? I didn't lose my hair. I'm 62 years old. Most guys, by the time they get to be my age, they start losing hair. I was lucky in that, but a lot of folks start losing their hair very young, and I think it's genetics, isn't it?
Yeah, I think it's mainly a genetic issue. Patients always want to blame themselves or maybe a particular family member, but it's mainly a genetic issue, and best to just face that and treat it for what it is.
Yeah,
Um,
fantastic.
so it's not necessarily hats or certain shampoos you've been using. So let's get rid of the blame game, and let's move on and let's and utilize the things, the treatments, the technologies, maybe the surgical options in some instances, that really can make that person feel better about themselves. And there's a wide
Fantastic.
range of options that we have today that we didn't have before.
Well, let's give a case study. Let's say I'm a 35-year-old man. I'm successful in business, and my hairline is starting to recede, and it's concerning me, and it's making me feel
Yeah.
old. And
Yeah.
I want to get that under control. We still want to have a full head of hair, but the last thing I want to do is I don't want it to look fake. I don't want to
Yep.
look fake. I don't want to look like I'm wearing a toupee. I want to look very natural. Talk to me about what I would experience when I came in and saw you, and what I could expect as far as results.
Yeah, that speaks to hairline design, and that only comes from experience. I've been doing this for about 23 years, so that experience is starting to add up. I would say that's over 20,000 surgical patients, and
Amazing.
many, many thousands more who've just come to see me for advice and maybe for medical treatment and other options. So you're speaking to the really most critical aspect of hair restoration surgery. That is in the hairline design realm. So you want to create a hairline. Yes, we want to take off a few years, maybe 10 years, what I say, maybe a little bit more in some instances. But the last thing we want is something that's going to look unnatural or inappropriate, for the coming years, because we want this to look right 10, 20, 30, sometimes 40 years in the future. You mentioned a patient who's 35. We have some patients that come to see us in their 20s. That's a
Yeah.
really daunting, awesome responsibility that we have in this field, and you want to do the right thing for that patient. So if that individual were to come into our office, we'd spend a sufficient amount of time to design that hairline for them. We give them options, sometimes a little more aggressive, sometimes a little more conservative, depending what their particular goals are. of course, within the guidelines of what's appropriate and medically responsible. So we give patients options. We discuss why one hairline might be more appropriate than another. And also, we have so many celebrity patients. They're in front of the camera, and they may have very particular goals for the big screen, let's say, or for a commercial appearance, or for their normal TV appearances. So it's really case by case. So you really want to come in, meet with me. Let me design some hairline options, and also integrate it in a larger surgical or medical plan. For that 35-year-old individual, it's not just about today and restoring that hairline for that patient, building up that hairline that the whole world sees, but it's also maybe just as critical, Bill, is in maintaining the hair. So we offer medical devices and products and medications that can help slow down the rate of hair loss. So it's a bit more of a comprehensive plan. And those are also things that might support a surgical treatment for that individual. So a lot of moving parts here. Best to come in, meet with us directly, meet with me directly, and let's address all of your issues and concerns and your particular stylistic or aesthetic goals.
That's fantastic. Now, once the hair has been replaced, sir, I don't understand the process of how it goes. It's a great mystery to me. Once it's been replaced, does the hair actually grow? Is it like real natural hair, or how does it work?
Well, hair restoration surgery's been around, let's say, since the 1950s, really, and quite a bit has changed since then. But yeah, the hair that we utilize is that very permanent hair that an individual has in the back of their head and the sides. We utilize that hair. We move that from those healthy, strong scalp areas, and we move it to wherever a patient may need it. So we have now some 70 years of track record speaking to the longevity of those grafts. And, I'm here to say that that hair is going to be around for a very, very long time. So that means, Bill, we better get it right, because that hair is going to grow today, is going to grow tomorrow, is going to grow 50 years from now. So we better get that right. And I think we have, and we're in a really great position today in hair restoration surgery. And I want to tell those audience members that you have out there, they're probably concerned about one issue more than any other, Bill. As you know, in healthcare, it is the issue of pain. And that really speaks to older procedures where we used a knife and a scalpel and sutures and stitches, and it was cutting and ripping and pulling. And that's still a technique that's being used out there, Bill. Probably by 70 or 80% of all hair transplant grafts. But we have an alternative, Bill. We have a method called the FUE method.
FUE,
And
okay.
we're one of the pioneers in this method, in the FUE method, follicular unit extraction method. Bill, that's where we're removing grafts literally one by one from the back of the head. And we're not using a knife. We're not using a scalpel. We're not using stitches, sutures, none of that cutting and ripping stuff. So the patient tolerance is so much better today, especially for those patients who've been through that before. Bill, let me tell you, they give us that feedback, and patients sometimes have been brutally honest with us, and they're like, hey, no, I don't want that old technique. I want this FUE method. And of course, having done over 10,000, Bill, of this particular type of hair restoration procedure called the FUE method, and that's the one by one approach. Patients really appreciate the difference. The comfort level. As you know, so many of my patients are from out of state. They're from out of town. They're flying in, and some of them are flying home the next day. They better be comfortable. And it's just a totally different patient experience today, Bill, where they don't have to undergo the knife. They don't have to undergo stitches and sutures and the cutting and the ripping and pulling stuff anymore. So
That's exciting.
and even more so, what has that allowed us to do from the result standpoint, apart from the comfort? Comfort's important, yeah, but we want results. And using this method, Bill, this has allowed us to do and perform much larger procedures than we ever could. So we're transplanting and implanting more hair, more grafts than we ever have before. So that's been a game changer. You talk about that proverbial guy in his mid 30s, let's say he just wants some hairline work. This is a great approach for that younger patient. We really didn't like and didn't think it was so many patients came in their 30s and 20s, and you had to do the cutting, the scalpel work, the stitches. Now you can have that younger patient. You don't need to cut them open. You use the FUE method, which, Bill, I think we've really refined, having done over 10,000 of these FUE
Yeah.
procedures. We've had to, because we're at the really cutting edge of this, so we've had to invent, create, and design our own instrumentation, which sounds like a lot of work. It has been a lot of work, but it's also been a lot of fun. We've been able to tailor, design, create, and make our own instrumentations to execute the FUE method, allowing us to have more patient comfort, and allowing us to perform larger procedures, addressing the younger patient, and really getting that hairline just the way we want it. So it's really been a game changer for that guy off the street, that VIP client, for everybody. So the industry is a little bit lagging, as any healthcare industry. There's something called inertia, where in general, doctors and health, as you know very well, doctors and clinicians, we're kind of slow to change. But as you mentioned earlier, that I practice all over the world, did a lot of work in Europe and the UK, and that forces a doctor to change. Moving around, seeing other techniques, seeing what's being done out there in the world, and we had to change, and we refined the approaches to the FUE method. And as I said earlier, we've designed, created, invent our own instrumentation. We don't use robotics. We don't use suction. We don't believe in that approach to hair restoration surgery. Everything we do is by hand. Nothing's better than the human hand. And I think we've really perfected the FUE method, Bill. So I'm so excited about what we can offer your audience. It's a game changer. And when you see the #1 basketball player on TV, he's had it. Every actor that you see on TV who lost their hairline, how do they maintain that hairline? Hair restoration surgery. The #1 golfer in the world, NBA, NFL MVPs, MLS MVPs, Stanley Cup champions. These guys, they're athletes. They're macho guys, right, Bill? They still care about their hair,
Sure.
Despite all those trophies on the shelves, and you met all of them through all of your interviews, right? And that hair still bothers them. And so for that guy off the street, come on in, meet with us directly, so we can create that surgical plan for you, or the medical plan for you, whichever route you decide to go. And Bill, as you know, sometimes people are not ready for, let's say, a surgical procedure. There's other technologies, other vehicles that we have that can buy you some time, hold on to that hair until maybe you're ready to take that step. So, Bill, I think it's so great to be on your show, because we have so much to offer patients.
Yeah,
They
it's
just don't know
very
about
exciting.
it. They just don't know.
It's very exciting. Okay, let's talk about the expense to people, because people say, well, that sounds great. That's something that I could ever afford. Can insurance pay for this? Is there financing available for this? How do people come in, and how they get this done without going bankrupt?
Everybody asks me, Art, you worked on all these celebrities. Oh, you're not for the regular guy. No, we never wanted to be in that position. While we enjoy working on those celebrity clients, that's great. But we do love changing lives for everybody that comes into our office. So we think hair restoration surgery is a tremendous value. It is affordable. We see people from all walks of life, Bill. There is financing. Insurance doesn't cover it, because that would probably just jack up the price, right?
Right. Yeah. Exactly.
So you wouldn't even want to go there, right? So there is financing. We work with you. We have so many solutions on that end of the spectrum, from the financial end. Talk to us. We're happy to work with you. Sometimes we have slots, and we're always looking for that fresh face, for the website, for videos and testimonials. There's so many ways that we can help a patient out there who wants to have this done, and we want to help them. It's rarely a hurdle where we can't get over. We have a lot of options today, Bill.
Fantastic.
We can help those guys.
Are you going to be working out of the Miami office at the Four Seasons, or where are you going to be?
Everybody knows me from the work I've done in Chicago. Built the largest clinic probably in the world. certainly in the United States, which is really saying something. So we really made our mark with
Amazing.
all those celebrities, and you know who all those guys are. Everybody knows who they are. They're all talking about me, talking about us, and what we've achieved. But you know, so many of my patients, you know, from the Midwest and around the country, where are they going, Bill? You know, they're going south. They're going to Miami. You know, it's the
Right.
hottest city
It's a
maybe in the
beautiful
world.
city. I lived there for
It's a
3 years. It's
beautiful
great.
place. I know you spend a lot of time there. You know, great airports. We're, you know, 20, 30 minutes from the Fort Lauderdale airport, the
Right.
Miami airport. Very easy to get to. So many flights in and out. And like so many of our patients travel from out of state, from out of town to come see us. So that's an important part. And, you know, so many of my patients, you know, have moved down to the southeast part of the country. You know, this is where all the growth is, right?
Yeah.
So it's a very exciting place to be. You know, as you know, we have that marvelous office within that Four Seasons hotel
It's a
building.
beautiful
That,
location. Yeah.
I mean, you can't beat that private
Yeah.
entrance and discreet. And then we have a boutique clinic just a few blocks away in the Infinity building, very discreet, very boutiquey. And so we're there to serve our patients wherever they choose to be. So we have options for them. We also have also a boutique clinic in Orlando. That's also another venue where patients, you know, very easy to get in and out of, and help facilitate getting this procedure done. So that's
Fantastic.
the reason we moved to Florida. You know, moved my team there. You know, that team that I work with today, that's the same team. You know, Bill, you know, you got a big team that supports you in what you do, right? So,
Yeah.
you know, your team is so critical to execute this wonderful service. And my team that was with me to work on all those celebrities I've worked on in the past, you know, they're with me down here in Miami. And it's just been a wonderful
It's
thing
exciting.
to
It's
rekindle
fantastic.
everything that and all that success that we've had. And I'm just following my patients, you know, they're moving down here, all these big hedge funds and
Everybody's moving. Everybody's
financiers.
moving down there. Yeah. It's
Oh
amazing.
my God, you know, and we feel blessed, you know, Bill, that we were a little bit ahead of the curve, you know, so we were able to structure everything that, you know, right, and get our cost structure right down there. Because again, speaking to your previous question, we want to make this affordable,
Right.
and we want to be able to, you know, manage our expenses, and so we anticipate all of this, and we're really so excited to be in Miami, one of the most exciting places in the world. You know, it's also exciting, Bill, you know, people from all over the world travel here,
Yeah.
and they believe in, you know, the institution of Miami today. It's the new Silicon Valley, right?
Right.
So people from all over the world come see us, and we're able to grow and treat those patients. You know, all those heavy hitters, you know, from the Middle East, you know, that crowd that comes from South America, and these are people, Buzz, you know, they can travel anywhere in the world for
Right.
a service like this, and they're
Right.
coming here, which is a heck of an honor, heck of an accolade, and we're trying to deliver the highest possible service in hair restoration surgery that really exists, and we're really pushing the envelope to deliver that, Bill.
That's wonderful. How can people reach out to you? Do they reach you at the topdocclinics.com
Yeah,
website to make a reservation?
that would be a great way. The wonderful people over there, they'll get you started because it is a journey, and we want to get you so we're face to face with each other as quickly as
Yeah.
possible. So, despite all those celebrities you've worked on, I'm happy to meet with each and every patient and
Great.
tailor make a plan for them. And that's why, you know, we're with Top Doc. You know, the name speaks to what we want to be, Top Doc,
I love
and
the
it's a
name. It's a
wonderful
great
place to
name.
be.
That's
We,
great. That's a
you
great
know,
marketing. Yeah. I love that name.
and we and that's what we want to be. It's a fun place to be. It's not work. It's a joy to be practicing at that level. And you know, Bill, when you deliver a service the way you deliver it, right? Everybody, all the top people want to join you. You know, it
Right.
just becomes more and more fun. So your team gets stronger and stronger and stronger, and you can deliver more effective procedures, higher level of service, and that's really what our clientele wants. You know, these are people that are coming down here to South Florida. They're used to the best. They want the best, and so working with TopDoc has just been fantastic. They know how to
Good.
treat people the right way, and but we want to funnel those folks who do reach out to us, want to get them face to face to meet with me so we can tailor make a plan just for them, Bill.
Fantastic. Folks, if you're listening to this interview and you think this might be a treatment that you would be interested in finding out more about, you can reach out to topdocclinics.com. You can also call 305 487 673-62 or 3054 Top Doc. And if you're watching this show on our website, just click on the Top Doc sponsor card and it'll open up their website and you can make an appointment right there. Dr. Art Katona, it's been great talking to you today.
Thank you, Bill. It's always great to see you. And I look forward to seeing you in our Miami facility whenever you can make it down there. And I'll take you out to dinner this time.
That sounds great. Yeah, I'll look forward to that. Okay, folks, this has been Dr. Art Katona, one of the top hair restoration doctors in the world, not just the country, but in the world. Folks, I'll be right back with the rest of the show in just a minute.